the big thing to remember when delivering any kind of healthcare service virtually is to focus on what that high value, high impact service that you provide as a clinician is, and then leverage that through the virtual visit. So how can providers ensure that patients receive quality care through virtual visits? So when I was consulting with a state agency years ago during the pandemic, and they were shifting everything from in-person clinical service delivery to virtual service delivery, I was tasked with developing kind of the protocols and the standard operating procedures for delivering services that had, for the long history, been delivered in person, face-to-face, and taking that interaction and making it go virtual. One of the things, and I'm going to lay out a few different things to keep in mind when you're going to virtual visits. The first thing is understanding, obviously, the limitations of a virtual visit. I mean, physical touch is not going to happen, things like that. However, the big thing to remember when delivering any kind of healthcare service virtually is to focus on what that high value, high impact service that you provide as a clinician is, and then leverage that through the virtual visit. So for example, I come from the outpatient orthopedic world. One point of view might be that, okay, it's our hands, like, right? We're able to manipulate, to stretch, to do whatever. That might be the high value. But if you dig deeper, the true value that any clinician provides in any kind of clinical interaction is knowledge translation. We just did a podcast on this. Go check it out, episode 98 on knowledge translation. However, the knowledge translation, our ability to take the vast, wide breadth of clinical knowledge and technical knowledge and skills that we have, and we are able to apply it to a specific patient's individual circumstance, their context, their situation. So understanding that that's the real value that any clinician brings to any kind of patient interaction or encounter, then we begin to understand, okay, what is the real value that we deliver? What should be the point of a virtual visit? And in my mind, and I think the research would bear this out as well, the value, or what we should focus on in virtual visits, is that knowledge translation component. So for the sake of delivering quality care through virtual visits, maybe you have caregivers involved. If it's a medically complex person or a person that needs assistance. So maybe you're training the caregivers or the caregiving staff on specific maybe transfers or safety or certain care things. Maybe it's just an educational component where you're kind of walking the individual through the process of care for their specific situation, their specific diagnosis. Again, I think it's very easy to get hung up on the virtual visit, and I can't touch a patient, and I can't do, I'm not going to be in the same room with the patient. How do we make this work? Understanding that the value that clinicians provide is knowledge translation, and then focusing on that, and then delivering that through the virtual visit is going to ensure, one, that the sessions aren't wasted, that the patients and their stakeholders, their support team, their caregivers, et cetera, feel and understand that this is still a valuable visit, even though you're not in the same room. And then actually affecting change through maybe behavioral change or lifestyle management, whatever it happens to be, leveraging your clinical knowledge, your clinical expertise, and bringing that to bear on the patient's specific situation is really where the value lies, and really where a lot of the time should be spent specifically on virtual visits.